How do MRI and CT scans find silent strokes? Imagine a stroke that happens quietly inside your brain, leaving no obvious signs or symptoms. These are called silent strokes, and even though they don't cause immediate problems, they can still do damage and raise your risk for future strokes or cognitive issues. So how do doctors find these hidden strokes? The answer lies into powerful imaging tools, magnetic resonance imaging and computed tomography scans. Magnetic resonance imaging, or MRI, is like a super detailed camera for your brain. It can spot tiny areas of damage that are invisible to other scans. MRI uses special imaging sequences, such as diffusion-weighted imaging, which detects recent strokes by looking at how water moves in the brain tissue. It also uses FLAIR sequences to see older, chronic lesions by suppressing signals from cerebrospinal fluid. These scans can identify small infarcts, which are areas where brain tissue has been starved of blood, including tiny deep infarcts called lacunar strokes, as well as white matter hyperintensities, microbleeds, and signs of brain shrinkage. Because MRI can produce very thin slices, less than 3 millimeters thick, and uses strong magnetic fields, it provides high-resolution images that reveal even the smallest abnormalities. This makes MRI the most sensitive tool for detecting silent strokes, especially since these lesions often do not cause symptoms but can still impact brain health. On the other hand, computed tomography scans, or CT scans, are quicker and more widely available. They are excellent for identifying large strokes caused by bleeding or major blockages, especially in emergency situations. However, CT scans are less sensitive when it comes to small, silent strokes. Tiny infarcts and microbleeds often don't produce enough change in tissue density to be visible on a CT scan. That said, CT scans are still useful for ruling out bleeding or large structural problems when someone shows symptoms of a stroke. Summary: MRI scans are the most reliable way to find silent strokes because they can detect subtle tissue changes and tiny infarcts that don't cause symptoms. CT scans, while less sensitive for small lesions, are valuable in emergency settings for quick assessment and ruling out other issues. Detecting silent strokes early is important because these hidden injuries can contribute to cognitive decline, gait problems, and increase the chance of a future symptomatic stroke. If you're concerned about silent strokes or have risk factors, talking to a healthcare professional about appropriate imaging tests can help with early detection and prevention. Always remember, individual cases vary, so personalized medical advice is essential for proper care.